Okay, the last part of our talk today, we're going to focus a bit on the types of therapies and some of the equipment you'll encounter when you're working with a client with chronic respiratory disease. Particularly going to have a look at some of the breathing exercises that you can teach the client or encourage them to do, which will help manage their symptoms and also improve their exercise tolerance. Okay, one of the pieces of equipment you'll see quite often is a pulse oximeter. It's a very inexpensive little piece of equipment here. Just put it on your finger and push the button. It'll come up with a number which measures your pulse and also what's called your oxygen saturation. It's very useful, it's non-invasive, very inexpensive, easy to use. It does have some limitations in that it doesn't always pick up a good trace, and you can't always trust the number unless you know you're getting a good trace of the pulse. Some of the limitations is if a person's circulation is not very good or their hands are cold, then it won't pick up a good trace. Also, there's some evidence that it doesn't measure very well with people with COPD. The normal reading should be above 95%, but it's normal for people with chronic respiratory disease to have a lower number. It shouldn't be below 90, but often you'll see people between 90 and 95. So when I say they're useful, but you shouldn't rely on the number, they're useful to check. If you see your client is short of breath, is breathing hard, they're looking a little bit distressed, then certainly use the pulse oximeter because that can tell you how bad things might be. Okay, now we're going to talk about some deep breathing exercises. There's 5 main categories here, but there are generally a couple of different techniques that can be very useful. So we'll run through them briefly. The first one's called pursed lips breathing. That's simply breathing in and then exhaling as if you might be whistling, but without actually whistling. What that does is control how fast you're exhaling, and it gives the person a better sense that they're in control of their breathing. The next one, coordinated breathing, is similar, but it's often accompanied with their exercising or when they're doing a particular activity. People tend to naturally do this when they're maybe in the gym, when they're lifting weights. They'll tend to inhale and then exhale when they're doing a particular activity. The next type is deep breathing. A couple of different techniques here. The one we're talking about here is inhaling and exhaling through the nose. And what you're doing here is taking a deeper breath than normal. And then exhaling maybe a little bit longer than normal as well. The other technique with deep breathing called huff cough, and this is, again, take a deep breath in, but then when you exhale, like that. The other technique of doing that is simply to take a deep breath in and then exhale as much as you can. You'll often find that when people do this exercise, it may make them cough. And in these environments, we have to be careful that we're socially distant or wearing a mask or covering our mouth if we're coughing. The last type of breathing is diaphragmatic breathing. This is a little bit complicated to explain, but it's essentially getting the client to put one hand on their chest and one hand on their tummy and just to feel their tummy moving in and out as they're breathing. It just encourages them to get a better sense and more in control of their breathing. The breathing is mainly done through the diaphragm, which is essentially just a muscle under the lungs. So when that contracts, you're exhaling and relaxing, inhaling. So you just get the patient to feel the movement of their chest, feel the movement of their tummy, and that's more in control of their breathing. Okay, so what I want to do now is I'll get Bob to demonstrate some of the deep breathing exercises while I talk him through them. Bob, so this is the pursed lips breathing. Okay, so mouth closed, breathe in through the nose, and then breathe out through the pursed lips. Okay, and the coordinated breathing is just the same technique accompanied with an exercise. We've got our person lifting the barbells. Okay. Now we'll do the deep breathing. So with this one, stand with your elbows back. So maximise your chest capacity and take a big deep breath, much as you can, and hold it for a few seconds and then exhale. So you can either do it through the mouth or through the nose. Okay. And the next one is the huff cough. So in through the nose, then out through the mouth with that coughing action. Okay. This one's particularly useful for a client who has that chronic bronchitis with a lot of mucus and phlegm build up. This can help them clear their chest. Okay. Now let's see if you can do the diaphragmatic breathing, Bob. One hand on the tummy, other hand on the chest. Breathing in, feel that diaphragm move and feel it move as you're breathing out. Okay. So those sorts of exercises are very useful for clients that get symptomatic or if they're undertaking some activity or exercise. If you see that your client's short of breath, first of all rest, but then get them to take some of these controlled breathing. You know, breathe out through the pursed lips, get them to take a little bit of deep breath, that sort of coordinated feeling. Okay, that's our presentation for today. For further information, we'll put a link to our websites where there'll be a copy of the slides and other information relating to chronic respiratory disease. Thank you, everyone.